Hello, I'm Brent, a consultant plastic surgeon. I trained as a student at Cambridge and St Thomas's Hospital and then went on to get a consultant job at the Queen Victoria Hospital, East Grinstead. This is the area where Mackindoe, Sir Archibald Mackindoe, dealt with the burnt war pilots during the Second World War. Recently, for the last 10 years, I've been concentrating on cosmetic surgery and have been around the whole of Europe and America learning from other people and discussing things. I've become a member of the British Association of Plastic Surgeons, BAPS, and also the British Association of Aesthetic and Reconstructive Surgeons. And these are the two bodies that require you to be a consultant in the NHS for several years before you can join these associations. And the meaning is that the person who is a member is trained correctly. And actually we all work together. If we do have any problems, we refer to each other. I'm now very happy to tell you some of the things I do. I'm going to talk about skin resurfacing lasers. As we get older, our skin begins to age, either through photo damage or just hereditary or just age. So we usually start with alpha hydroxy acids. Cleopatra, she's our big example here. Do you remember she bathed in ass's milk? But it wasn't that lovely clear milk we saw in all the films. It's smelly old rancid milk that's gone off, but it has lactic acid in it. And this fruit acid on your skin takes away the dead cells at the top and smooths it down. And these days we can buy these preparations. So that's the first thing. You do that every day, perhaps after the age of 32, 35 onwards. It takes away the dead cells and improves the colour of your skin. It also helps the skin turn over more quickly because as the dead cells float away, so new cells at the bottom grow quicker in order to take up the space. These preparations, alpha hydroxy acids, were first used for skin cancer patients because of the sun damage they had had, but recently we found that because of the improvement in the skin texture, they are the magic anti-aging creams. The next level is this chemical peel, and I'm a great advocate of the trichloroacetic acid peel, 30%, which takes a deeper layer away. If you take deeper layers away, that's more appropriate for deeper wrinkles, acne scarring, and something that needs more aggressive treatment. The downtime for that is about 5 to 7 days. You put the acid on, you wait a few hours, and you go from a white colour to a red colour. Then a few days later your skin goes black and gently peels off. To get more aggressive though, we go to the lasers, and these are for really deep lines around here. That's when we use what we call a fractional laser. Or if it's just fairly bad sun damage, you can resurface your face with a resurfacing laser. Now interestingly, in the past, the laser, the YAG laser, has either been too superficial, it hasn't really done a very good job, very much like a chemical peel, or the other laser we used to have was the CO2 laser, was too aggressive. It burnt you too much and it heated you too much and you had a very long downtime, like 3 months. So, what do? Happily, very recently, the new Cutera laser has come out with a new wavelength and a different crystal. And this is in between these two other lasers. And so this has great properties in speeding up the downtime and the wound healing. So first of all, let's talk about the pearl laser. That is the one that removes the superficial areas of your skin uniformly all over your face, and this just rejuvenates you, takes away age spots, and makes you look generally fresher. And this is good for people around about 40, 50, that sort of area. It takes a week to get over it. You peel like mad for 2 or 3 days, but then after that you'll just look red. So 1 week. The next laser is the fractional laser. Now in the olden days, as I said with the other lasers, you used to remove a very deep layer of skin, and the skin had to heal from below from hair follicles. And it took ages. But now, with this fractional technology, you pierce little bits very deep, but you leave bits of skin without being pierced. And so you heal very much quicker from epithelialization from the areas that are left behind. Now the trick, of course, is to get enough burning to remove the bad stuff with the rapid healing. And this is where the fractional pearl with a new wavelength comes in. So these days, if you have a fractional treatment, it's 2 weeks downtime, not the 3 months we used to see. And after the 2 weeks, you are red, you are able to go out, your skin has exfoliated, and you're very smooth. Now, in my opinion, this is extremely good for those really deep wrinkles around here, the perioral area, because in one treatment, you can virtually, as you can see, take many of these out, probably 80%, I would say. And again, it's a 2 week downtime, but you can put makeup on after about 10 days to hide that. But it's a one stop. If you've got more wrinkles, of course, you can have the deeper treatment round further areas. But again, it takes 2 weeks. Finally, you can put the two lasers together. Because if you just do an area perhaps around here and you don't do the next bit, you might find a tide mark. One area looks good, one area doesn't. So if we're only doing this area, we stick to it. But if we're going further, we prefer to use the deep fractional laser here and the ablative, the pearl, around the rest of your face. So we call that the pearl fusion because we're fusing two technologies. Because I'm a plastic surgeon and I've been practicing for many years, I like to think of my laser treatments as part of the package that I do. So with some people it's appropriate they have a facelift or upper and lower eyelid blepharoplasty plus the laser at the same time. And this is where we get some of these really fantastic results where perhaps the patient has a facelift, their eyes, a brow lift, then we laser the refreshing laser all over and the fractional over the deeper bits. And therefore you get, in one hit, you get a really amazing result, as you'll see. So the laser, the pearl, is new because of the new wavelength. The advantage is it resurfaces your skin, takes a lot of your wrinkles out, but the downtime is roughly 2 weeks. When combined with other treatments, our facelift, eyes, they still take 2 weeks to heal, so you might as well be sort of having everything healing at the same time. So at the other end of it, you've really lost very little time. I enjoy using my laser and I've had some great results. I perform these laser surgeries at the Spire Hospital in Tunbridge Wells. Although the laser can be transported to other locations, my team there know everything. It's a general anaesthetic if you're having your whole face done, local anaesthetic if you're having just part of it done, and it's day case. You can of course stay overnight if you've come from a long way, but normally it's day case surgery and we explain to you exactly how to look after yourself. First of all you see me, then if we decide to go ahead you come and see me and my nurse when we tell you exactly how the aftercare is. Then we have the treatment, which is a day case, and then I see you a week and 2 weeks afterwards, and then usually a month later. If you're thinking about this sort of laser treatment, then you can always give my office a call and make an appointment to see me. My consultations are free, and this is because everyone knows about plastic surgery, what they do. What we have to do in this consultation is work out, is it suitable for you? The techniques we all know. So give us a call on 01892 740 044, and we have clinics in Kensington, Brighton and here in Tunbridge Wells.